Explanation. Do you sometimes feel suddenly weak, dizzy, or like your heart is pounding for no clear reason? Those can be clues that your adrenal glands, the tiny factories on top of your kidneys, are not making enough hormones. This emergency is called an adrenal Addisonian crisis. Imagine your body's power grid losing electricity, lights flicker, appliances stop, and you feel a sudden crash. In the same way, without enough cortisol and aldosterone, your blood pressure drops, sugar falls, and you can become very sick fast. Let's walk through what causes it, how it shows up, and what you can do to stay safe. The crisis usually begins when something destroys or blocks the adrenal glands. The most common reasons are autoimmune Addison's disease. Your own immune system attacks the glands, like a security guard mistakenly locking you out of your own house. Infections, severe infections such as tuberculosis, fungal infections, or HIV can damage the glands. Bleeding hemorrhage, sudden bleeding into the adrenal gland, often from trauma or blood clot problems, shuts it down. Medications, abruptly stopping steroids like prednisone that were taken for a long time, removes the hormone supply. Cancer spread, tumors that spread to the adrenal glands can destroy them. Think of each cause as a different way the power plant can be shut down: sabotage, flood, fire, or a sudden cutoff of fuel. When the adrenal glands stop working, the body sends warning signals. Severe fatigue or weakness, you feel like you could fall asleep standing up. Dizziness or fainting, especially when you stand up quickly, low blood pressure. Nausea, vomiting, or abdominal pain, your stomach feels upset, like after a bad flu. Rapid heartbeat, the heart beats fast to try to keep blood flowing. Low blood sugar, hypoglycemia, you may feel shaky, sweaty, or irritable. Darkening of the skin, hyperpigmentation, long-term Addison's can cause a tanned look, but during a crisis, it may not change quickly. Dehydration, because aldosterone is low, the kidneys lose too much salt and water. A quick way to test yourself: if you stand up, feel dizzy, then get a sudden headache and nausea, it could be a sign of adrenal crisis. Never ignore these signs. They need urgent care. Doctors confirm an adrenal crisis with a few steps. Blood tests checking cortisol should be very low, ACTH usually high, electrolytes low sodium, high potassium, and blood sugar. Rapid ACTH stimulation test gives a short dose of ACTH and measures cortisol rise. A poor rise confirms adrenal insufficiency. Imaging, CT or MRI of the adrenal glands if a tumor or bleeding is suspected. Treatment is immediate. IV hydrocortisone, a high dose given through a vein, like plugging the power line back in. IV fluids with saline, to replace lost salt and water and raise blood pressure. Glucose, if blood sugar is low, a sugar solution is given. Mineralocorticoid replacement, fludrocortisone, often started later for long-term control. After the emergency, patients learn to carry an emergency steroid injection kit and wear a medical alert bracelet. Think of it as a backup generator you can use until the main power is restored. Follow-up appointments monitor hormone levels and adjust oral steroid doses to keep you steady. You can lower the risk of a crisis by never stopping steroids abruptly. Always taper the dose under a doctor's guidance, like slowly dimming lights instead of flipping a switch. Having a steroid emergency card, write down your condition, normal steroid dose, and emergency instructions. Give a copy to family and friends. Keeping an injectable hydrocortisone kit at home, work, and in your bag. Practice the injection with a partner. Wearing a medical alert necklace or bracelet that says adrenal insufficiency needs steroids. Staying hydrated and eating enough salt, especially in hot weather or when you sweat a lot. Regular checkups with your endocrinologist to adjust doses during illness, surgery, or pregnancy. Research in the last few years has focused on making adrenal crisis safer and easier to treat. Modified release hydrocortisone chronocort, a tablet that mimics the body's natural cortisol rhythm, reducing the chance of low-point crises. Subcutaneous steroid pumps, small devices that deliver a steady low dose of cortisol, similar to insulin pumps for diabetes. Genetic studies, identifying people with autoimmune genes that predispose them to Addison's, opening doors for early screening. Rapid point-of-care cortisol tests, handheld devices that can give a cortisol level in minutes, helping emergency staff act faster. Education apps, smartphone apps that remind patients to take stress dosing steroids when they're sick and guide them through emergency injection steps. These advances aim to give patients a smoother, more reliable power supply and help doctors catch problems before they become emergencies.